to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're having an important conversation about mental health support for older teens and young adults, a group that often falls through the cracks during a really pivotal time in life. I'm joined by Rachel Hyman, a licensed clinical psychologist who works closely with teens, young adults, and families to help them navigate anxiety, depression, grief, and trauma. So thank you so much for joining me today. Dr. Hyman, welcome to the show, and we're so glad to have you here.
Thank you so much for having me.
Of course. So maybe a good place to start would be to kind of tell our listeners a little bit about your background and sort of what led you to focus your work on older teens and young adults specifically.
Sure. I'm a clinical psychologist. I've been practicing for over 20 years, and I've worked with a whole variety of different age groups and populations in a lot of different settings. And I found that I really enjoy working with teens and young adults, as the stage in their life is one of exploration and growth and change. And it's so formative, and they're going through, so many major life transitions. I really enjoy helping them through this process, especially when it can be really confusing and difficult, and it can be really helpful to have a neutral person in one's life, just to be able to talk things through. So that's kind of how I really became interested in working with that population.
That's wonderful. I think it's a really important group because, we've had a few different psychologists on that kind of specialize in different areas or different age groups and so forth. But, the young adults and teens, that often is a lot of times when their health kind of changes as well, like their physical health and so forth. And so a big component is the mental health challenges, and sometimes that's kind of overlooked. So I think it's really important to sort of highlight that today and really focus on them, because I think that age group deserves to have some specific discussion on. So that being said, what are some of the most common mental health challenges that you see in teens and young adults that you work with?
It's probably not surprising. My first response will be anxiety. There's just so much worry and uncertainty about their future and about the world, which seems very unsettling right now. And I think that that's just become a lot more prevalent. And it's also what is actually really positive is that the stigma of anxiety as well as other mental health challenges have decreased. And so that's also, I think, made people feel more comfortable kind of sharing the things that they go through and their willingness to seek help. I think also in particular social anxiety. I mean, that's always existed, kind of a self-consciousness, especially in the younger age group. However, I think social media has exacerbated this experience for a lot of people. So I see a lot of that. I see a lot of depression, kind of, as a result perhaps of some trauma or loss. And because of their experience with anxiety, depression and anxiety are often very linked. Often relationship issues, self-esteem issues, those are also really common as well.
So you emphasize that therapy isn't a quick fix. Can you talk a little bit more about what the therapeutic process looks like for an individual that you would see?
Sure. First of all, I think one has to be really interested and ready. It's not something that somebody, can say to somebody, oh, you should really go to therapy and, it could be good for you. But if somebody, great for somebody to suggest that. However, if somebody is not feeling ready and willing to engage, then it probably won't be super helpful. But it's really, once one, kind of is open to it, I think it's really helpful to know that change and growth are possible. Feeling stronger and more confident are also possible, but it does take effort and commitment. So when I like to see myself as a guide, but my clients are in charge, the time that we have is their time. I say that, and this is their time to talk in a safe space about the issues that are on their minds. But the therapeutic process is really supposed to be and is collaborative, and begins by really establishing a trusting relationship together. Then I like to set goals, and then different interventions are used to achieve the goals that are set. And therapists can utilize a whole variety of different treatment methods to help their clients. Some more common modalities that people may have heard of is CBT, cognitive behavioral therapy. That's pretty popular and pretty commonly used. There's also a therapy called ACT, which is acceptance and commitment therapy. Those are just two, for example, of kinds of interventions that might be used.
That's wonderful. So many of our listeners are managing chronic health conditions or ongoing medical stress. And so, a lot of times people can sort of think that private patient advocates are generally for like an older population, but that's definitely not the case. We have many of our clients that are younger as well. How does mental health support fit into that specific picture in relations to managing chronic health conditions or ongoing medical stress?
I think mental health support's a really key component for those struggling with chronic health issues, as emotionally it can be really difficult to manage the challenges to one's physical health. Anxiety and depression are common when one is managing difficult health problems. So, utilizing therapy to really help alleviate the anxiety and depression one is feeling can be really helpful. I mentioned CBT and ACT earlier, and these modalities in particular can be really useful when confronting mental health struggles that one feels as a result of the physical, as a result of one's physical illness. Like CBT, for example, works to help challenge and reframe some negative or unhelpful thinking patterns, for example, and ACT can help with acceptance as well.
I love that. That's great to know. I also really love that you also offer telemental health. And I think that is so important. Much of our work is also done virtually. And, I have many thoughts on the benefits of that, expanding demographics, expanding access to care, and so forth. But can you share how you see that benefits, in your opinion, to your clients?
I mean, really convenience more than anything. It's really helpful. I tell my clients that choosing telehealth versus like in-person therapy is really just a personal preference. And that research actually indicates that it's just as effective as in-person therapy. But so many people find it really convenient just to be able to access that care, from wherever they are. And it obviously, eliminates any driving times, but it also makes it more accessible for people perhaps who live further away from a provider. For example, for like I can see anybody in Washington State, and most providers would be able to do the same, in the state in which they're licensed.
That was my next question, just to kind of let our listeners know you practice within Washington State. Is that correct?
That's correct. Yes.
Okay. Well, this has been such a helpful and validating conversation. Before we wrap up, where can listeners learn about you and your services a bit more?
Thanks for asking. Probably the best way is just to find me on my website. And well, the title of my business is Rachel Hyman Clinical Psychology, and my website is drrachelhyman.com, which is just drrachelhyman.com. And they can feel free to contact me through my website or to email me as well. So.
Wonderful. Well, Dr. Hyman, thank you so much for joining us today. Your thoughtful, compassionate approach and your emphasis on long-term healing really highlights how powerful the right mental health support can be, especially during such a formative stage of life. To our listeners, if you're navigating health challenges, including mental health challenges, whether personally or as a parent, know that help is available and that you deserve support that truly meets you where you are. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journey. Thank you so much and have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.